Hey everyone, Dr. Jump here, and this is the first video in a set of videos where I talk about the different landmarks of the scapula, and then I add some content and talk about the muscles that attach to these various landmarks. So if you'd like more information, background information about the different landmarks for the entire skeleton, head over to my website, anatomyonthego.com. I also have a Facebook page that has the exact same name. So what I'll do is I'll review the landmarks of the scapula, and then we'll learn the muscles that attach to these specific landmarks on the scapula. So I'll hit on some of the landmarks in this first video, and then in the subsequent videos I'll talk about the additional landmarks that we can see on the scapula. Then I'll review, and then I have a practice quiz for you, both multiple choice questions and identification questions as well. So on this slide, in the image here, you can see various muscles that we have on our bodies, but I'd like to highlight the one that's shaded dark red, and that's the trapezius. And then lateral to that, basically surrounding the upper part of your shoulder, is the deltoid muscle. We can see a few other muscles. You may be familiar with the latissimus dorsi, which is at the bottom of the image. But let's focus here on trapezius, red shade, and deltoid. Then we'll add some muscles as well here as we go through. Also on the slide, we can see the teres major and the teres minor, which are lateral to the scapula and beneath or inferior to the deltoid. So let's dive into a few other muscles here. On this slide, you can see several different muscles, but the two that I'd like to highlight are rhomboid major and rhomboid minor. So in red is the rhomboid major, and then above that, superior to that, is the rhomboid minor. So note that they are attaching to the medial aspect of the scapula there that you can see pictured, and that's just lateral to those muscles. So let's highlight these key landmarks. We have the acromion process, which is indicated by the red circle there. That's the most lateral part of the scapula. It's a continuation of the spine of the scapula, which is a very good posterior landmark. It's above the socket of the scapula. In the socket, we have a ball and socket joint of the shoulder. The ball is actually the head of the humerus, and then the socket is this glenoid fossa. So you can see the acromion located superior to this glenoid fossa. And glenoid fossa is incidentally a really good lateral landmark. If that's facing you, you know you're looking at lateral. So what muscles attach here are the trapezius muscle and the deltoid muscle. Trapezius was that diamond-shaped muscle that was shaded red in the previous slide. So then we have the spine of the scapula. This is a horizontal line spanning across the back of the scapula. So as soon as you see this landmark, you know right away that you're looking at the posterior scapula. It's a great way to know that. As soon as you see it, posterior, you know that right away. So the trapezius muscle and the deltoid muscle also attach here to the spine of the scapula. Then we have the medial border. This is the border of the scapula that's toward midline or toward the spine. It's on the side that's opposite the glenoid fossa. The glenoid fossa is always lateral, so the medial border is opposite this glenoid fossa. The muscles that attach here are the rhomboid major and the rhomboid minor muscles. Then we have the lateral border. This is the border of the scapula toward the outside of the body or toward the shoulder. It's on the same side as the glenoid fossa, and what muscles attach here, the teres minor attaches here at the lateral border, and what also attaches close to this area is the teres major muscle. So we'll see that here in just a second, but teres minor attaches here, lateral border. The inferior angle is where the teres major muscle attaches, so that's the most inferior aspect of the scapula there, as indicated by the red circle. So let's review here. So we have the red circle, that's the acromion. The blue horizontal line, just medial to that, is the spine of the scapula. Then if we go down a little bit, we can see the green line indicating the lateral border, the red line indicating the medial border, and then the inferior angle is indicated by the blue circle there. So on this slide, again, we have the trapezius and we have the deltoid. We can also see the teres major and teres minor, among other muscles, which I will dive into in subsequent videos as we talk about the muscles associated with the scapula, and then we work our way to the humerus. So before we get started as well, I want to introduce two terms, origin and insertion. Origin is basically where a muscle begins, and it's relatively fixed, i.e. it doesn't move, and so relatively so. There tends to be some movement across the body, But there are places where origin is very, very fixed, very, very stable. And then in general, insertion is where a muscle ends. This is the part, the attachment that's relatively mobile. It does move at this point. So essentially, this is the part that's pulling, where the movement is actually occurring, whereas the origin is the anchor point in general. So that's just to give you an idea of what these terms mean as I talk about the attachments here. So the muscles, we have trapezius. The origin is all along the spine. We have the spinous processes. So these are the posterior aspect of the vertebral body. Then we have a ligament attachment here. This is basically the continuation of the ligaments that are superficial to the spinous processes. Excuse me, finding my words here. Also the occipital bone. The insertion here is the clavicle, the acromion, which you've seen, the spine of the scapula, a few other insertions. And then we have the action here is elevation, depression, retraction, and rotation. So on yourselves, think shoulder shrugs at the gym. You pull up on your scapula, basically shrug your shoulders toward your head. That's elevation. The opposite movement is depression. Retraction would be pulling the scapulae backward toward your spine, basically. Then rotation is essentially just movement of the glenoid fossa. You're rotating the scapula to have different angles, pointing anterior, posterior, up or down, depending. So basic idea of the trapezius there. Then we have the deltoid, which is located lateral to the trapezius. We have origin here. You can see the clavicle, the acromion, the spine of the scapula. Then we have this special place on the humerus, the lateral humerus, about a third of the way down the humerus, called the deltoid tuberosity. And this is a roughened portion of the humerus where the deltoid muscle attaches. So the action is shoulder flexion, extension, and abduction. So basically, this is the movement of moving the shoulder forward, backward, or to the side. So typically when I talk about this movement, abduction, I will say it just that way. I'll say abduction, so it's not confused with the other term that's similar, adduction. So that's basically just pulling the arm away from midline. So there's the deltoid muscle indicated by the blue. Then we have teres major and we have teres minor. So in general, if we have a pair of muscles, we have a major and a minor pair. The major is typically the larger one of those two muscles, and the minor is the smaller one. So the teres major attaches, the origin here is the inferior angle of the scapula, and then it inserts medial to this thing called the intertubercular sulcus of the humerus. So this is just a fancy word for between the greater and the lesser tubercles of the humerus. So if you go to my blog, you can see how we have a greater and a lesser tubercle. They're located on the anterior part of the humerus, so that's the front part of the humerus. So when this muscle acts, it actually pulls the humerus toward midline, so that's adduction, as opposed to abduction, which is pulling the humerus away from midline. And then we also have the action of medial rotation. So basically, it's rotating your humerus toward the center part of the body. So there's teres major. Note that it's inferior to the teres minor. There's the teres minor. So the origin of this muscle is on the lateral border of the scapula, and then it inserts at the greater tubercle of the humerus. So again, that's a landmark that's on the front of the humerus. And its action is lateral rotation. The reason that is because it basically wraps around the posterior aspect of the humerus to attach at the greater tubercle. It's also one of the rotator cuff muscles. So on this slide, we can see, again, you've seen this already briefly, you can see your rhomboid major and your rhomboid minor muscles. So the rhomboid major, the larger of the two, rhomboid minor smaller. The origin is the spinous processes of T2 to T5. And so that's just basically thoracic vertebra 2 to thoracic vertebra 5. And then the insertion is the medial border of the scapula. And so that insertion is actually below or inferior to where the rhomboid minor attaches. So this muscle is responsible for retracting the scapula, rotating the glenoid fossa in different orientations. For example, like we talked about with the trapezius, and also stabilizes the scapula. So retraction is basically like a rowing motion. You're pulling your scapulae away toward the back, basically towards your spine as well. That's retraction. Rhomboid minor there is indicated by the red arrows. So the origin is the nuchal ligament. So again, that's the continuation of a ligament that's superficial to the spinous processes. Also the spines of C7 to T1, so that's the 7th cervical vertebra to the 1st thoracic vertebra. So the insertion here, just like the rhomboid major, along the medial border of the scapula, but in this case it's above superior to the rhomboid major. Same thing here, the action is the same along with the rhomboid major. Retraction of the scapula, rotation, it also stabilizes the scapula. So here we go. We have, now we can add muscles that attach to these landmarks. So we have the acromion indicated by the red circle. We have attachments for the trapezius, the deltoid, the spine of the scapula, same muscles there, trapezius and the deltoid. Medial border, we have the attachment for which is the red, excuse me. That's the rhomboid major and the rhomboid minor. The green is indicating the attachment for the teres minor, and then if we add the inferior angle there, just below the two lines, then we're talking about the teres major muscle. So on this slide, we can see trapezius indicated by the shaded red there, and then also beneath that and lateral to that, we have teres major and teres minor. So the lower red arrow is showing us teres major attaching to the inferior angle of the scapula. And then superior to that, we have the teres minor. And then in the picture on the right, we have the rhomboid major and rhomboid minor. Rhomboid major is the inferior one, and rhomboid minor is the superior of the two, and is smaller. So let's go ahead and do some practice questions here. So which of the following muscles attaches to the acromion? And of the choices below, which of those does that apply to? So if you said deltoid, you are correct. You could also say, it's not an answer choice here, but you could also say trapezius muscle. So question 2, the blank muscle attaches on the scapula at the inferior angle. So that would be teres major. Which of the following muscles attach at the medial border of the scapula? Okay, rhomboid major and rhomboid minor. Major attaches more inferior compared to the rhomboid minor. Okay, identify this muscle here highlighted by the blue arrow. All right, you could say rhomboid major, correct? And then we have this identification. What is the blue arrow indicating? What would you say on that? That's right, it's the deltoid muscle. So that's located lateral to trapezius. Deltoid is a shoulder flexor, extensor, and abductor. Okay, what is this muscle? There's the trapezius. Okay, so this is an introductory video for the muscles that attach to the scapula. I'll be diving into more detail about the muscles. We'll talk about the nervous supply, which nerves innervate the muscle. We'll talk about blood supply. I'll just go through this sequentially, break into smaller chunks for you. But remember, on my website, you can learn the entire skeleton from top to bottom. I have blog video content for tips for skeletal muscle anatomy. I have a podcast where I'll be answering your question and just creating questions that I know that you'll need to know or need to be familiar with to learn anatomy well. And then on Facebook, feel free to message me if you'd like to connect. I'll continue to post questions, tips, live video, etc. to help you learn. And then I also, just FYI, have some courses that I'll be creating. My first course will be Introduction to the Human Skeleton. Basically, well, you'll just learn everything about the skeleton. So I'll let you know about that as I finish creating that. But anyway, here you go. There's a video for you. I hope this helps. If you have questions or you'd like me to fill in the blanks for you, I'm happy to do that. And thanks. I'll check you later. See ya.